Problem definition and recognition. Pale mucous membrane are common clinical signs of this order of diseases. It is best evaluated by examination of the mucous membrane, primarily of the oral cavity. Physiologic vasoconstriction may result in visible pallor in normal cats and many nervous or apprehensive dogs. Other factors, such as excitement and physical exertion, can produce the appearance of a healthier color, particularly of the oral mucous membrane. Classification of pale mucous membrane. Classification of pale mucous membrane are manifestation of either: first, anemia. Under this we have the underproduction of red blood cells and the number of healthy red blood cells destroyed, either blood loss or blood destruction. Second, decreased peripheral perfusion. Here we have three: hypovolemic shock that are caused by endogenous fluid and hypoadrenocorticism. Cardiogenic shock caused by myocardial failure, tachyarrhythmias, and lastly cardiac tamponade. Vascular shock caused by presence of septic shock, neurogenic shock, pain, and trauma. Anemia pathophysiology. Anemias that are caused by a problem with underproduction of erythrocytes. Presence of kidney or renal failure means that there is insufficient level of erythropoietin that would cause an understimulation of the entire process that would certainly lead to underproduction of RBC or anemia. When bone marrow is sick because it was infected by a virus or taken over by a tumor or fibrosis, that would result to underproduction or no red blood cells produced because it did not have room for production. Moreover, erythroblast has huge and lots of DNA in the center, but when there is insufficient precursor to make all this DNA, it would prevent making of erythroblast and as many as erythrocytes. Lastly, common cause of underproduction anemia. Erythrocytes are filled with hemoglobin and this hemoglobin have lots of components to it. When there is shortage in components or problem in production of hemoglobin, underproduction anemia occurs. Anemias caused by number of healthy red blood cells being destroyed. Blood destruction. Blood destruction happens when our immune system stated to attack or destroy the red blood cells. Another cause of destruction anemia is when pathogens such as virus and bacteria attacks the red blood cells result to destructive anemia. Blood loss. Blood loss happens when there is a tear in the blood vessel and the blood started to escape and hemorrhage out. Under decreased peripheral perfusion, first we have hypovolemic shock. In hypovolemic shock, there is low amount of blood in the intravascular space thus able to return to the heart. From the heart it runs into, it tries to pump blood to the organs, but the organs are not getting enough oxygen, not getting enough blood because the system does not have a lot of blood in it. To understand hypovolemic shock, let's take a look at our cardiovascular system. There are baroreceptors in the vasculatures that assess blood pressure. If low blood pressure is detected, sympathetic nervous system kicks out by increasing system vasculature's resistance in response to maintain blood pressure. The body does that by vasoconstriction, because when diameter of blood vessel decreases, we have increased resistance. So, the blood is squeezed forward to the venous system to maintain preload and blood pressure. The blood is now diverted away from the less essential organs from skin and diverted to essential organs such as brain, lungs, and heart. The blood is no longer coloring the skin, presenting a symptom of pale mucous membrane. Cardiogenic shock pathophysiology. Here we have a picture of a cross-section of a heart where we can see different various compartments: the right atrium, right ventricle, and left atrium, left ventricle. Failure of the heart pumps result in less cardiac output, which means less tissue perfusion. Factors that result from heart failure are valvular problem. One is damage or narrowing of compartments or aortic pulmonary outflow tract, making it extremely hard for the blood to push out through the aorta and out of the system. Stiffness of the ventricular wall of the heart, which prevent from being able to contract properly, and if the pump itself is so severely disabled, this can lead to shock, lowering blood pressure, and decreased ability to deliver the necessary oxygen in the tissue. Arrhythmia, when there is an issue in electric conduction. If the blood cannot be pumped forward, it will back up and will back up into the left atrium, and when the heart can no longer accommodate all this fluid overload, it goes back up to the lungs, as well each side of the lungs. If this thing goes worse and worse, it will be back up into the veins and all the way to the right side of the heart. It can also be back up all the way into the system, resulting to fluid overload. This would lead to couple symptoms like pulmonary congestion, increased jugular venous distension, chest pain, and pale mucous membrane or cool skin due to blood is diverted away from the skin to more vital organs such as brain. Extended diagnostic plans. Once history and physical examination lead to an identification of the body system associated with the mucous membrane changes, and the patient has been initially stabilized, additional diagnostics are used to establish the etiology. Causes, possible physical examination findings, diagnostic procedures. Cardiovascular, weak bounding pulses, pale, white, blue mucous membrane, pulmonary crackles on osculation, murmur, arrhythmia, tachycardia, bradycardia, dull cardiac osculation, tamponade. Thoracic radiographs, blood pressure, ECG, CBC, chemistry, urinalysis, echocardiogram. Hemorrhage, pale, white mucous membranes, overt visible hemorrhage, body cavity infusion, pulmonary crackles on osculation, or dull, missing pulmonary sounds. Body cavity radiographs, treat primary injury, CBC, total solids withdraw more rapidly than PCV, coagulation panel, PT, APTT, D-dimer, buccal mucosal bleeding time. Dehydration, tachycardia, pale, white mucous membranes, decreased skin turgor, increased CRT. CBC, chemistry, urinalysis, fecal flotation if diarrhea is the cause, endoscopy, biopsies if vomiting and or diarrhea is the cause. Anemia, pale, white mucous membranes, CBC, chemistry, urinalysis, reticulocyte count. Symptomatic treatment. In case of cardiogenic shock, we give furosemide and venodilators for preload reduction. Inotrope therapy. Drugs like digoxin, dobutamine, or dopamine is given when there is myocardial failure. Antiarrhythmic therapy during tachyarrhythmias, and for the cardiac form, pericardiocentesis is done. For anemia and hypovolemic shock, blood transfusion and volume fluid replacement, either whole body, plasma, electrolyte solution, or volume fluid replacement.